next we have the joint diseases. So where do they occur? Usually in the diarthrodial joints, but it's worth knowing what synarthrodial joints are. So synarthrodial joints are joints that are basically immovable because of fibrous tissue or cartilage. So it's very rare to get a disease here, except maybe fracture. So one example may be, so for example, I actually fractured my knuckle in my left hand here, and that's actually an immovable joint. So that's kind of the only injury I would have gotten in that area, a fracture, which, as they said, is quite rare. Now, diarthrodial joints, these are the opposite. These are mobile opposing bone ends. Let's use the knee as an example, covered by articular cartilage, as we can see here, articular hyaline cartilage, and it's separated by a joint cavity. So this space here is called the joint cavity, and it's filled with synovial fluid. Why is synovial fluid important? It's because it basically lubricates and nourishes this articular cartilage along with the synovial membrane it's covered by during weight bearing. So when we get a joint disorder, how is it usually caused? Well, it's written here. Trauma, chronic inflammation, maybe something going on there, like an infection they've mentioned here, developmental factors, which we're going to get into. But yeah, when it comes to trauma, it could be, they've mentioned luxation, for example. So we're all familiar with luxating patella, so the patella pops out of place. But that's not the only thing. It can actually cause pain in the long term and other issues. There's subluxation, fracture, I already mentioned, instability of the joint for whatever reason. Maybe the joint capsule can even be penetrated. So I said this is the joint capsule, and this can lead to septic arthritis, inflammatory processes breaking down this articular hyaline cartilage, and joint inflammation. What does it look like? Well, lameness. It looks like lameness, and it's often severe. And if we're talking about synovial sepsis, so when this area is infected, it needs immediate and aggressive treatment to preserve the joint, because when there's an infection here, the first thing that's going to be broken down is the cartilage. Now, let's talk about some developmental abnormalities. The first type is osteochondritis dissecans. I won't go into too much detail. They've just given it as an example. There's also equine ataxia. This usually occurs because there's been some malformation of the cervical vertebrae or malarticulation. Lumbar disc syndrome in certain breeds, canine hip dysplasia. I'm not going into these because we're talking about them later. These are usually caused by inflammation. Now, why is inflammation bad? It's not just because of inflammation, but what happens is the joint tries to fix itself, and what you end up getting generally is overcompensation for fixing something that can't be fixed, which results in cartilage loss and a loss of joint function. So basically, the fact that your joint is trying to help itself when it's being infected, it actually makes the problem worse. There's also osteoarthritis. I've got a very nice picture here. Well, I say nice, it's not nice. So osteoarthritis, it's a progressive degenerative disorder that affects diarthrodial joints, particularly their articular cartilage. You can see it's like worn away. And basically, obviously it occurs because of aging, we all know this, but also trauma, abnormal or excessive mechanical forces. Let's say you're like me and you're always sitting down crossing your legs. That's very not good for your knees. A lot of Asian people actually end up with arthritis because of that. Poor conformation, so maybe the knees don't meet properly. Actually, when we were talking about luxating patellas, they can actually exacerbate this process. Hormones, genetic factors, so if your mum had it, you'll probably have it, and sepsis. And it's a common cause of obviously pain, morbidity, so the appearance of it will look worse, and decreased performance. Obviously, like you can't function the same way like this. So you'll definitely see lameness, joint swelling, because you'll have joint effusion. Remember, the joint is trying to take care of itself, so that means when it inflames, there's going to be cells in the area. Thickening of the joint capsule, ironically, new bone formation you can see here, so you'll probably see this upon x-ray. Loss of the normal range of motion and pain upon flexion of the affected joint. What's flexion? It's when the knee bends, like that. How do we treat this? Corticosteroids, of course. Steroids will reduce inflammation along with NSAIDs for the symptomatic treatment of osteoarthritis, except obviously with cartilage loss. It actually makes the disease worse. It's only before cartilage loss you can use NSAIDs and corticosteroids. So what do you use instead? A chondroprotective. Now, chondro actually refers to the chondrocytes. So these are the cells that build up your cartilage. So what's a chondroprotective? These are things that basically contain things that cartilage contains. So the example they gave there you probably saw was hyaluronic acid. If we gave hyaluronic acid, injected it here directly, it would actually slow down the progression of osteoarthritis by enhancing the matrix synthesis, and it will also reduce the inflammatory effects in that area. So if you're asked one question about how to treat osteoarthritis, it's that.